Hey everyone, and welcome back to the Deep Dive. Today we are heading over to India to take a look at the healthcare system in Madhya Pradesh.
Yeah, really fascinating stuff.
It is, we hear a lot about healthcare challenges across India, but what makes this deep dive so interesting is this state, Madhya Pradesh, has a really unique mix going on, right? You've got a large tribal population and this blend of urban and rural communities that really makes it a perfect case study for looking at, the broader issues with delivering healthcare in India.
I think that's a great point. Madhya Pradesh really kind of shows us, in a microcosm, what's happening across the whole country.
Yeah, exactly. Sort of a microcosm of the challenges and opportunities.
Exactly.
And we've got some really interesting excerpts here that are going to help us uncover a lot of that stuff, the key initiatives that are happening, some of the hurdles that they're facing, and maybe even brainstorm a little bit about potential solutions for a healthier future there in Madhya Pradesh. Sound good?
Let's do it.
Okay, so let's kind of start by mapping out this healthcare system a little bit. And looking at the sources, I'm seeing a sort of three-tiered structure run by the government.
Yeah, that's right. You've got that tertiary care right at the
Yeah.
top. Those specialized hospitals really equipped to handle, the complex cases.
Yeah, the higher level stuff.
Exactly.
So I'm seeing places mentioned like the All India Institute of Medical Sciences, the AIIMS in Bhopal, I think.
Yeah, AIIMS Bhopal, that's a big one.
Huge. And then also the Gandhi Medical Colleges.
Right, the GMC.
GMCs, you'll find those in a lot of the major cities like
Yeah.
Indore and Gwalior, right?
Mm-hmm.
So if you needed advanced surgery, specialized treatment, any of that kind of higher level care,
Yeah.
these would be the places to go.
Exactly. You go to those tertiary care centers.
Gotcha. And then kind of stepping down a level, you've got the district level, right?
Yeah.
And so there they've got hospitals in, places like Ujjain and Satna, kind of providing that, more general care.
More general, yeah.
Yeah. Right. But then it seems like the real backbone, especially when you get into these more rural areas,
Yeah.
are the community health centers, primary health centers, and then even sub-centers.
Those are crucial, especially in those rural areas, where you don't have easy access to those bigger hospitals.
Yeah, makes sense. Like
Yeah.
a tiered system.
Mm.
Seems logical enough in theory, right?
Mm-hmm.
But what really jumps out at me from these sources is that huge difference between the urban centers and then the rural areas,
Mm-hmm.
especially the tribal areas. It's almost like two different worlds when it comes to healthcare access.
That's such a crucial point. You think about it, somebody living in Bhopal, they might have multiple hospitals within easy reach, right?
Easy access.
But then, contrast that with somebody living in a remote village,
Yeah.
maybe, in a really hilly district like Alirajpur, where just getting to the nearest primary health center could be, a huge ordeal miles away, limited transportation.
Yeah, it's a journey.
It is. It's a real barrier.
And I mean, adding to that, a lot of these sources mention that significant tribal population there.
Right.
Folks like the Bills and the Gons who might be facing, geographical barriers, but also cultural differences that make accessing healthcare even more complicated.
Absolutely. And that's where, we start to see all these government initiatives trying to come into play, right?
All right, got to bridge that gap somehow.
Exactly. And
Yeah.
there's a whole slew of programs that we're seeing aimed at doing just that. There's that Mukhyamantri Balaroga Evam Pashan mission, big name.
Yeah, try saying that 10 times fast.
Right. But that one focuses on, child health and nutrition, a really important issue there.
Really important.
And then, of course, you've got the Ayushman Bharat scheme, providing health insurance coverage.
Yeah, I'm seeing that mentioned a lot here.
Yeah, it's a big one.
And then the Mukhyamantri Swasthya Bima Yojana. That's another one, right?
Yeah, another health insurance initiative.
Okay, so a couple different approaches there. And there's also the Lakusha program. That one's focusing on improving maternal and child care during childbirth.
Yeah, that's right. Trying to reduce those maternal and infant mortality rates.
Okay, so it seems like, the government is really throwing a lot of different programs at this.
They are, and it's commendable. They're really trying to tackle this issue from multiple angles.
Yeah. Seems like good intentions, but it makes you wonder, how effective are all these programs really being?
Right, that's the key question.
Because I'm looking at some of the stats here, and, take child malnutrition, for example. Madhya Pradesh still has one of the highest rates in India, right?
Yeah, it does.
And that's despite all these programs.
Right.
So it kind of raises questions about the implementation,
Yeah.
Are these programs really reaching the people who need them most?
Are they being implemented effectively? Are they reaching those most vulnerable populations? These are questions that we really need to be asking.
Yeah. So maybe good intentions, but the impact is, maybe falling a little short.
Potentially, yeah.
Okay, so that leads me to the next question. What would you say, looking at all this, are some of the biggest obstacles that are standing in the way of better healthcare in Madhya Pradesh?
Well, I mean, we've already touched on one of the big ones, right?
Yeah.
Accessibility. That stark difference between what's available in those urban areas versus those rural and especially tribal areas.
The urban-rural divide.
Exactly, but it goes beyond just physical distance, right? I mean, there's a really severe shortage of medical professionals, especially in those rural and tribal regions.
Yeah, I'm seeing that in here too. They're talking about like high vacancy rates for doctors and specialists. Why is there this reluctance to work in these areas? You know, it can't just be the distance.
Yeah, I mean, think about it. It's not just about being far away from the big city. It's about, often a lack of infrastructure, limited resources, maybe even safety concerns,
Yeah, not an easy place to live necessarily.
It's not. It's a challenging environment to attract and retain those skilled healthcare workers.
And I mean, you layer on top of that the cultural and linguistic differences, especially in those tribal communities. And it just creates even more barriers for those healthcare providers.
Absolutely. It's this really complex interplay of factors, but I think it's important to also remember, just the disease burden itself. Madhya Pradesh has, it faces significant challenges with things like malaria,
Right.
tuberculosis, and then increasingly you've got, more and more of those lifestyle-related diseases cropping up in those urban areas.
Yeah, as things change.
As things change and modernize. So, all of that really points to a need for really robust disease prevention and awareness campaigns, especially when you consider, literacy levels and awareness levels in some of these areas.
A lot to overcome.
There is. It really...
It seems like they're fighting a battle on multiple fronts there. But, I wonder, what about the private sector?
Ah, good question.
Could they hold some of the answers here? Do they have a role to play?
Yeah, that's where things get even more interesting, right? Because we do see these private hospitals. They're flourishing in those urban centers, especially cities like Indore and Bhopal.
Right. They're doing well.
They are. They're becoming real hubs for medical tourism, actually, thanks to their, specialized care offerings.
Yeah, because they can offer that higher level care.
Exactly.
So people are coming in from elsewhere specifically for that.
Yeah.
But I'm guessing that success doesn't really translate so well to those rural areas?
Unfortunately not. You've got high operational costs coupled with, often a lower financial capacity of the rural population. It just makes it a much less appealing market for those private players.
It makes sense from a business perspective, right?
It does, but it leaves a gap.
It does. It's like this disconnect where private healthcare is thriving in the places where it's already somewhat accessible.
Yeah.
But the real need is in those underserved areas where they're just not rushing in.
Exactly. That's the dilemma, right? And it's why, a lot of folks are pointing towards these public-private partnerships, these PPPs, as a potential solution, right?
Interesting.
Imagine if the government offered, tax breaks or subsidies or even infrastructure support to incentivize these private hospitals to actually set up shop in those remote areas.
Right, create some incentive for them.
Exactly.
It's almost like a win-win, right? Where the private sector gets a chance to operate sustainably, and then those underserved communities finally get access to healthcare.
You got it.
It sounds good in theory, but I wonder, are PPPs really like a cure-all?
That's a great question.
Are there downsides to that?
Right.
Are there other models we should be considering?
Right. We need to be thinking about those potential downsides, unintended consequences, things like that.
Definitely. And I'm also curious about, the role technology could play in all of this.
Oh, yeah.
We've been talking about building hospitals and, getting people to go to the hospitals, but could we be, flipping that a little bit?
Yeah.
Could telemedicine be part of the answer? Could we use mobile health apps to, reach people where they are?
Yeah, that's a fantastic point. Let's definitely delve into that a bit further. I think there's a lot to unpack there, a lot of potential in those areas.
Definitely. There is. Before we were talking about the potential of the private sector.
Right.
And these PPPs. I'm thinking, even if we get the private sector involved, even if we get these partnerships going, shouldn't we also be talking about the role that the people themselves play in all of this?
Absolutely. You're spot on. I mean, we can build all the hospitals, we can create all these great programs, but ultimately, health outcomes really come down to individual choices.
Right.
And community actions. People have to be empowered to take care of their own health.
Exactly. So how do we move beyond just, providing healthcare and start creating this, culture of health and well-being?
Yeah.
I'm thinking especially about, those rural and tribal communities where we were talking about, those lower literacy and awareness levels.
It's a challenge, for sure. But it's not insurmountable. Imagine if we had these health education campaigns that were really tailored to those specific communities, you know, using their languages, their cultural references, really meeting people where they are.
Right, it's got to be relevant to them.
It does. Think about, using folk songs or traditional storytelling to spread messages about hygiene, nutrition, you know, early disease detection.
Yeah, that's a great point. It's about, like, using those familiar channels that people already trust and understand
Exactly.
to make that information resonate. Which kind of brings me to technology, too. We touched on telemedicine before, but it seems like there's a lot of potential there, right?
Oh, huge potential. Think about, mobile health apps that could track your health indicators or send vaccination reminders or even provide, some basic medical guidance in those areas where it might be hours to reach a doctor.
Right. So instead of waiting for people to reach healthcare, we're using technology to bring healthcare to the people.
Exactly. Bring it right to them, wherever they are. And we can even go further with that. Imagine using data analytics to map disease hotspots.
Oh, wow.
Right? So then you can have these really targeted resource allocation and intervention strategies.
So we can be proactive about it.
Exactly. Be proactive, be data-driven. And technology, I think, can really be a game changer there, especially in a state like Madhya Pradesh, which is so geographically diverse.
Right. Huge state, lots of different challenges.
That's a challenge.
It sounds like a really powerful combination, those high-tech solutions to kind of bridge those gaps, and then that high-touch community engagement to make those solutions sustainable over the long term.
I think that's the key, sustainability.
Exactly. But, let's shift gears for a second here, because I'm looking at these excerpts, and they talk a little bit about medical tourism.
Oh, interesting.
Particularly in Indore and Bhopal.
Yeah.
And I wonder, could that be leveraged to actually improve the overall healthcare system?
That's a really insightful question, because medical tourism is growing in those cities. And it's really focused on that specialized care. So, if it's channeled effectively, that revenue could be used to, upgrade rural health infrastructure or train healthcare workers, maybe even subsidize care for low-income communities.
So essentially the specialized care that these, medical tourists are seeking out
Right.
could actually indirectly benefit the broader population.
It could. It's a really fascinating idea, but it would require, really careful planning and a real commitment to equitable distribution of those resources.
Excellent.
But it does highlight that potential, for those creative solutions, leveraging those existing strengths to address, some of those systemic weaknesses.
I like it. I like it a lot. Okay. So we've covered a lot of ground here. We've talked about the challenges. We've brainstormed some potential solutions. We've talked about the role of government, the private sector, technology, even the people themselves. So much. So if you were advising policymakers on, the most critical areas to focus on, what would be top of your list?
Oh, that's a tough one. There's so much.
So many things to tackle.
There is, but I think for me it starts with medical education.
Okay.
We need to be training doctors who are not just, skilled clinically, but also culturally sensitive and prepared to actually work in those rural and tribal areas.
Right.
So,
They need to be ready for those unique challenges.
exactly. So, imagine if medical schools had these mandatory rural rotations, really exposing those future doctors to the realities on the ground.
Yeah. Get them out there. Get them experience.
To get them experience. So it's about creating that pipeline of healthcare professionals who are not only qualified, but really committed to serving those underserved communities.
Committed and passionate.
Absolutely.
Yeah, that's important. But I mean, training alone isn't enough, right?
It's not. You have to address that infrastructure gap, too, building more of those primary health centers, equipping them properly, ensuring there are reliable transportation links.
Right. Make it possible for people to get there.
Exactly.
Yeah.
All of that's crucial. And of course, making sure those facilities are adequately staffed with, qualified personnel once they're built.
Right. It all goes together.
It's like a multi-dimensional puzzle, you know?
Yes, it is.
You can't solve one piece without considering all the others.
A lot of moving parts.
A lot of moving parts. And let's not forget, the importance of continued investment in those public health programs, too. Things targeting, malaria, TB prevention, and early detection. That's crucial.
Right. Stopping things before they start.
Except
Or catching them early.
Catching them early. Absolutely.
And then, there's the issue of funding, right? I mean, all these initiatives, all this infrastructure, it requires, some serious financial resources.
It does, yeah.
So how can Madhya Pradesh ensure that there's that sustainable funding for their healthcare system?
It's a tough question. I think part of the answer lies in exploring, those innovative financing mechanisms. We've talked about, the potential of that medical tourism revenue.
Right.
There's also the possibility of, performance-based funding, where healthcare providers are incentivized based on health outcomes.
Interesting.
Rather than just the number of patients they see.
So rewarding quality of care over just, quantity.
Exactly. Quality over quantity. I think that could be a really powerful incentive.
I like that. I like that a lot.
Yeah.
But, I also think it's important to acknowledge that improving healthcare, it's not just about government policy. It's not just about funding.
Right.
It's about individuals and communities taking ownership, too.
Couldn't agree more. It's about, promoting those healthy lifestyles, participating in those health education programs, and advocating for better healthcare access.
Right.
Everyone has a role to play in this.
I think that's a great note to end on.
I do too.
This has been an incredibly insightful deep dive. We've learned so much. We've talked about so much. It's clear, that the challenges facing healthcare in Madhya Pradesh, they are complex, they're multifaceted.
Yeah.
But it's also clear that there are these dedicated individuals, these innovative programs, and a growing recognition of how important that community involvement piece is.
That community piece is so essential.
It really is. And as we, kind of move forward, I think it's just crucial to remember that those sustainable solutions require a long-term vision. They require collaborative efforts and a willingness to adapt and learn as we go.
Very well said.
So to our listeners, we encourage you to stay curious, stay engaged, and keep exploring ways that you can contribute to a healthier Madhya Pradesh and, even beyond.
This deep dive, it's just the beginning of the conversation.
Yeah, just the start.
There's so much more to learn, so much more to discuss, and most importantly, so much more to do.
Until next time, keep exploring, keep questioning, and keep striving for a world where quality healthcare is a right, not a privilege. All right, we're back and ready to wrap up our deep dive into Madhya Pradesh's healthcare system. We've talked about a lot.
We have.
The challenges, those potential solutions, and the role that everyone plays, from the government to individuals, in really creating that healthier future.
And it's interesting. What's really struck me throughout this whole deep dive is how interconnected everything is.
Yeah.
It's like geography and infrastructure, resources, even cultural beliefs.
Yeah.
It all comes together to shape those healthcare outcomes. It's a complex system for sure.
It is.
But I think understanding those connections, that's crucial if we want to find solutions that really work,
Right. It can't be a one-size-fits-all approach.
It can't.
You got to consider all those different pieces. It's like we've been piecing together this puzzle.
Yeah.
Right? And we're finally starting to see that bigger picture.
Yeah, the bigger picture is starting to emerge.
But, with all the challenges that we've talked about, all the things they're facing, I'm curious, what makes you hopeful? What makes you think that positive change is possible in Madhya Pradesh's healthcare landscape?
Well, honestly, it's the people.
Okay.
I've seen firsthand, the dedication of those healthcare workers, especially in those remote areas. They're overcoming incredible odds to deliver care, and the resilience of those communities, finding ways to support each other and address their health needs. Those are the stories that really give me hope.
Right. Those stories of, individual and collective action. They're inspiring, for sure.
Sure.
They remind us that even those small steps can have a really big impact.
Absolutely. And it's not just about reacting to those problems. It's about creating that culture of health,
Right.
where people feel empowered to really take charge of their own well-being.
So as we're wrapping up this deep dive, if there was one key takeaway you want our listener to really think about, to ponder, what would it be?
I'd say don't underestimate the power of your voice and your actions.
Right.
Advocate for those better healthcare policies, support local health initiatives, spread awareness. Every effort, no matter how big or small, it all contributes to a healthier future. Not just for Madhya Pradesh, but really for everyone.
It all adds up.
It does.
It's not just a government responsibility.
Sure.
It's a collective effort.
100%.
And everyone has a role to play. That's a powerful message to end on.
I think so, too.
It's a reminder that, the challenges might feel daunting at times, but there's always hope.
Yeah.
And there's always something we can do to make a difference.
Always.
So to our listeners out there, we encourage you to stay curious, stay engaged, and keep exploring ways to contribute to, a healthier Madhya Pradesh and beyond.
Keep that conversation going.
Keep it going, exactly. Until next time, keep exploring, keep questioning, and keep striving for a world where quality healthcare is a right, not a privilege. Thanks for joining us.